CCAM's intelligence-based information system, IBIS, is changing lives and having a great impact on improving patient care. Since it began in 2011, it's become a real success story, with more than 40,000 patients registered and over 2,000 health and social care professionals using IBIS to share patient care plans. The system links primary, secondary, social and emergency care teams. It has reduced avoidable ambulance transports to A&E to 35% for registered patients by providing a single accurate source of patient information, which supports a holistic approach and partnership working. Patient case managers upload care plans onto IBIS, so the latest information about a patient who may have very complex needs is readily available. Care plans can include clinical information as well as specific patient preferences from everyday treatment to end-of-life care wishes. So CCAM clinicians can provide the right care at the right time in the right place.
Urgent and emergency care services can be quite difficult to navigate. There are a lot of options, particularly in the community, but with IBIS it tells us where the patient's registered and where we can go to straight away for that information and to get the best possible care for the patient. Instead of coming up with a completely new treatment plan for patients, it gives us the option to build on a plan that's already there, and that provides a continuity of care for the patients as well.
IBIS on a day-to-day basis is a really useful tool. It's great for tracking what's happening with your patients. As soon as a 999 gets dialed, we get an alert to tell us an ambulance has been called, so we already know that there's somebody that's needing some help. It's a very useful tool for gathering information about what's happening with your patients, the reasons why they're having 999 calls or being conveyed. The end of episode reports that we get through have lots of useful information like recommendations as to how to help this patient stay at home rather than conveying them to hospital.
Systems like IBIS are really useful in linking primary and secondary care. The ambulance service have to do a lot more acute calls now. In the old days, GPs used to go out to see patients at night time and would know their patients well. However, things have changed and now the ambulance service are there instead of us. The system sends discharge summaries to GPs, and this really helps us understand what has gone on at that time and also the follow-up arrangements.
Health and social care professionals using IBIS include specialist nurses, mental health teams, hospital trusts, hospices, nursing homes, GPs, social services and community practitioners. In the last year, 50,000 emergency calls to CCAM had a care plan available on the system. On average, every month 685 conveyances to A&E are avoided, equating to 345 avoided hospital admissions.
The frailty team are very lucky in that they go and visit patients in their own homes, nursing homes and rest homes, and have a chance to talk with them about their future care planning. We can have some quite difficult conversations with them that wouldn't be appropriate to have in hospital, and we can involve members of the MDT so that we've got everybody's views before we collate a plan for that patient. That is then uploaded onto IBIS, which is the brilliant thing, so that any paramedics who should go out or any other professions that may see this patient can look at that information and see what the plan is for that patient.
IBIS has been particularly useful when advanced care planning for our patients. I have spent a lot of time with patients' families writing advanced care plans, peace planning for the future. By being able to upload these plans onto IBIS, I know my patients' wishes and choices are being listened to. I would highly recommend this to all other services because I think it gives patients a voice and it just ensures that communication goes across every care agency.
IBIS is supporting the hospice at home service by collaborative working, optimising the patient services that we can offer. It's a clear, constructive tool to use. It's allowing all members of the team to be aware of the patient's wishes at end of life and giving them contact number to call so we can, hospice at home or the DNs can become involved in that patient and preventing unnecessary hospital admissions.
Every 999 call to the Emergency Operations Centre is compared against the IBIS database to see if there is a care plan for that patient. If there is, an IBIS data assistant, IDA, immediately informs the responding ambulance clinicians of a match. A notification is also sent to the patient case manager via SMS or email to tell them their patient has called 999. Once alerted, the case manager is able to make contact with the crew on scene to assist with the patient and offer alternative referral options. If the patient is conveyed to hospital, the IBIS system notifies the case manager, meaning they can liaise with the hospital if the patient is admitted.
IBIS is good in the sense that we can document on the system that patients may have abnormal chest sounds, may have abnormal saturations, but obviously that's normal for them because of their chronic respiratory condition. So they may not always necessarily need pharmacological input because of it may be an anxiety attack, so we can give support in other ways. The end of episode summary that we receive from IBIS is particularly useful. Not only is it because of it helps us identify admission avoidance for those patients, but also patients that have been admitted to hospital, we can get care in early and facilitate early supportive discharge.
Our main role on the IBIS desk is to match the incoming 999 calls against the patient's care plans and to inform the responding clinicians. Once we have notified the crew about the match and they have made the contact with the patient and made their initial assessment, they can call the PP desk and access the information available. Also on the IBIS desk we use the IBIS's functionality to do the false referrals for the patients, hypoglycemia notifications and to send the GP summaries.
Following an initial patient assessment, the crew can contact a paramedic practitioner in the Emergency Operations Centre, access the care plan on IBIS and discuss a treatment plan. Shared decision-making is good practice for any patient with complex conditions. Paramedic practitioners are specialists in urgent and emergency care, so can advise on the best treatment for these patients.
As a specialist paramedic, the IBIS system allows me to support crews with conveyance decisions when they call us within the EOC. We often have access to the patient's broader medical history and the teams that they're under, which allows us to share that information with the crews on scene, discuss it, be a second pair of ears and allow us to have an opinion in the decision-making process with the crew. That helps us ensure that patients are treated more effectively and reduces the likelihood of them being conveyed to hospital.
In the past, when we didn't have the use of IBIS, the only way mental health teams and practitioners would know about frequent calling of ambulances or attendance at A&E would be when we attended local network support meetings at GP surgeries. Nowadays, using IBIS, we get more timely interventions or notifications by the ambulance crew so that we can put support and appropriate signposting in at an earlier stage and prevent things from escalating.
Following treatment, a clinical update is added to the IBIS record, including baseline observations, diagnosis, interventions and outcome. This update is added both when the patient is cared for at home or if they are conveyed to hospital. The record is then closed and an end-of-episode summary is immediately sent to the patient's case manager so that the care team can review the patient, follow them up in the community or facilitate early supported discharge.
IBIS really gives me confidence to know that the support network is there for the whole family and it's a document written in black and white that can be followed in bullet points and prevent a lot of hesitation and long-winded conversation when as a carer you are pretty physically, mentally, emotionally exhausted most of the time. Since IBIS has been in place and we've experienced it many times with our local ambulance service, it's continuity of care. We all work together. I support the GP in feeding him the information and we can feed all the sources to outreach nurses, to district nurses, the whole team, respiratory physios, all can link together and work off one document.
The best thing about IBIS is that it empowers us to make the best decisions for our patients and it allows us to treat our patient as a person.
The best thing about IBIS is recognising patients' wishes and communicating them to anybody that's involved in their care.
The best thing about IBIS is the fact that no matter how a patient goes about accessing their care 24/7, as a specialist team we're able to follow that care up and give our input.
To me, IBIS means fewer inappropriate conveyances to hospital.
The best thing about IBIS for mental health patients is that it re-educates them that 999 isn't always the most appropriate service to call.
The best thing about IBIS is that patients have a voice and their wishes and choice can be documented and adhered to.
The best part about IBIS for me is the fact that for the first time ambulance clinicians get a direct path to the community teams that are involved with our patients.
One of the best things about IBIS is the communication between all parties involved in a patient's care.
IBIS means to us as a family continuity of care with every professional involved in the team, and knowing that they can walk through the door at any time or have phone contact and know what our wishes are as a family.